Let's take a look at the entire picture. Is this drug for real and is it safe? We bring in Dr. Christopher McGowan, a gastroenterologist, an obesity medicine specialist, and founder of True You Weight Loss. Dr. McGowan, thank you so much for being with us. So we hear,
Nicole.
it sounds like this truly is a miracle drug. Do you think drugs used specifically for weight loss are a good thing or a bad thing?
Yeah, Nicole, these medications are the real deal. And I'd say they're not just a good thing, they're a wonderful thing. I mean, we have desperately needed new treatments for weight and for obesity for far too long. We look at nearly half of the US population being affected by obesity. And until very recently, we've had two options. We've had diet and exercise, which we know doesn't work well enough for most people. And we've had bariatric surgery, which most people don't want. And there's been nothing in between. So we now have legitimate effective medications, and we're seeing real progress in this field. That's a positive.
Well, Doctor, that honestly leads me right to my next question. I mean, are the days over of hearing the old diet and exercise advice, or is that advice maybe only applicable for those who need to lose a few pounds?
I wish those days were over. It's kind of hard to believe, but patients are still being told by medical professionals that the way to lose weight is just to eat less and move more. I mean, that's silly. It's not that simple. The fact is, someone affected by obesity needs a much more effective intervention. Diet and exercise are the foundation of any weight loss treatment, but we need better treatments. Obesity is a disease. It needs to be treated as such. This is not a matter of willpower. It's not a matter of effort. It's not a lifestyle choice. We need to treat obesity as the disease that it is. And these new medications are really addressing that effectively.
All right, and I just want to reiterate here, you are an obesity medicine specialist, doctor. But some of the apprehension, surrounding these weight loss drugs, and I think it's legitimate apprehension, are the potential long-term effects. Because in the short term, we see, oh, this is great, losing 25% of my body weight if I need to lose a significant amount of weight. But what about 5 years, 10 years, even 15 years down the line? What about what could happen to my body as a result of whatever effect this drug has?
Yeah, it's a legitimate question. So first of all, if you look at the clinical studies of Mounjaro and Wegovy and these GLP-1 medications, the safety profile is actually excellent. We know patients will have side effects. We know they have nausea and diarrhea and constipation, but most of those side effects are, well, they're mitigated over time, they improve, they're tolerable. The actual real serious side effects are rare. So that's reassuring. But what we don't know is when we roll these medications out to potentially millions of patients who will be using them long term, what might surface? We might then expose some of these more rare or unknown side effects. So that is a question. But for me as a provider in this field, I'm reassured by the fact that this class of medications, the GLP-1 medications, have been used for well more than a decade with really a very reassuring safety profile.
So let's talk about access. Sloan talked about it a bit in her piece there. We did see problems with the supply of Ozempic for people who needed it to manage their diabetes, because again, the same drug, they just call it two different things, whether it's used for weight loss or whether it's used for managing diabetes. But are we looking at the same potential issue here, where people who need the drug for, one medical reason, I'm not going to say one is more legitimate than the other, but they may not be able to access it?
Yeah, so access is definitely an issue with these medications. So we can talk all day about how wonderful they are, how effective they are, but if patients can't access them, it kind of doesn't matter. In reality, the biggest barrier is cost and insurance coverage. So we see so many patients who are eligible for these medications. They're excited to use them, and then they find out their insurance doesn't cover them, and it's incredibly disappointing. And the reality is that most insurance plans don't currently cover these medications, and the out-of-pocket cost is well more than $1,000 a month. And that's month after month. These are meant to be used long term. So that's really not an option for most people. So there's tremendous issues with access. Now, there have also been issues with supply. We've seen this with Wegovy and Ozempic and Mounjaro. A lot of those issues are improving. So I think that that's certainly addressable. The bigger issue is insurance coverage and cost.
Yeah, there's still a lot to be discussed on this. I have questions about, whether or not our society is too focused on weight. We don't have any more time. Dr. McGowan, we'd love to have you back to continue this discussion. Thank you so much.
Thanks so much.